Welcome to Shanvis Media Education. Critical Care Nursing Test Paper 3 Part 4. Before we have discussed Part 3, who are preparing for staff nurse preparation examinations, OET, SNB, HAD and Prometric NORCET examinations, and along with the ESIC exam also it will be very helpful. So coming to the topic, question number 1. A client is receiving dopamine hydrochloride by intravenous infusion. The nurse should have which medication available for local injection for IV infiltration and medication intravascular occur. The correct answer is phenethylamine. The explanation of this question: phenethylamine is a alpha adrenergic blocker agent that prevents the dermal necrosis and slowing after the infiltration of the norepinephrine or dopamine. Vitamin K is the antidote for warfarin. Atropine sulfate is the antidote for cholinergic crisis. Protamine sulfate is the antidote for heparin. The question number 2. A client is brought into the emergency department in ventricular infiltration. The nurse prepares to defibrillate by the placing in defibrillation pads on which part of the chest. The correct answer is to the right of the sternum and to the left of the pericardium. The explanation of this question: the nurse would place one gel pad to the right of the sternum just below the clavicle and the other gel pad to the left of the pericardium. The nurse would place the electropads paddles over the pad. The remaining options are identify incorrect positions. The third question: the nurse is teaching cardiopulmonary resuscitation CPR to a group of community members. The nurse tells the group that when the chest compressions are performed on the infant, the sternum should be depressed how far? The correct answer is to about 1 by 2 inches 4 centimeters. The explanation of this question: according to the American Heart Association 2015 guidelines, when the CPR is performed in infant, the sternum should be depressed at the last one third of the depth of the chest, which is about 1.5 inches or 4 centimeters depth. The remaining options are incorrect. The fourth question: a client has received a transfusion of platelets. The nurse evaluates the client benefiting most from this therapy of the client exhibit which findings? The correct answer is decreases oozing of blood from puncture sites and gums. The explanation of this question: platelets are necessary for the proper blood clotting. The client with insufficient platelet may be exhibit frank bleeding or oozing of the blood from puncture site, wounds and mucous and membranes. Increases hemoglobin and hematocrit levels would be occur when the client has received transfusion or red blood cells. An elevated temperature would be decline to normal after infusion of the granulocyte because of these cells were instrumental of fighting infection on the body. The fifth question: in order by priority place the nursing action that should be taken a pediatric client in the event position ingestion, all options must be used. The correct answer is administer the antidote prescribed, and the second one is assess the ABCs airway and breathing pattern and circulation. The explanation of this question: in this event a position the nurse treat the child first, not a position. The ABCs airway breathing and circulation and vital signs are assessed. Cardiopulmonary resuscitation is initiated immediately if necessary. Exposure to the position is terminated next, such as emptying the mouth of pills or other materials or flushing in the skin of other body areas. Then the position is identified by the questioning the patients and witness of the event to the determining appropriate treatment. The nurse administers the antidote or takes other measurement prescribed by the primary healthcare provider, such as the administering activated charcoals. The nurse documents the occurrence, assessment, and findings and position ingestion, treatment measures, and child responses. The sixth question. The nurse is assessing a client with multiple trauma who is the risk for developing acute respiratory distress syndrome. That nurse should be assessed which earliest sign of acute respiratory distress syndrome. The correct answer is increased respiratory rate. The explanation of this question: the earliest detachable sign of the acute respiratory distress syndrome is an increased respiratory rate, which can begin from the 1 to 96 hours after the initial result to the body. This is followed by the increasing dyspnea, air hunger and restriction, and accessory muscle and cyanosis. Breath sound may be clear or consent of the fine respiratory cackles or diffuse courses and cackles. The seventh question. A client in shock develops a central venous pressure CVP or 2 mm of Hg. Which prescribed intervention should be the nurse implement the first? The correct answer is increases the rate of the intravenous IV fluids. The explanation of this question: the nurse MAP and CVP are both low for the client, indicating a shock state. Shock is the result of the adequate tissue perfusion. The fluid volume should be the immediately restored first to the provider. Adequate perfusion or the client in the shock state. Although the increasing rate of the O2 flow may be the necessary intervention, perfusion is the first priority. Obtaining the arterial blood gas results and inserting an indwelling urinary catheter may be necessary intervention to the monitor the client responses to the prescribed therapy, but there is no the priority. Eighth question. A client who is receiving intravenous fluid therapy complains burning and feeling of the tightness at the IV insertion site. On assessment of the nurse detects coolness and swelling at the sites and notes that the IV rate has slowed. The nurse determines that which complication has occurred. The correct answer is infiltration. The explanation of this question: an infiltrated IV line is one that has dislocated from the vein and is lying to the subcutaneous tissue. Polar and coolness and swelling at the IV site result when the IV fluid is deposited in the subcutaneous tissue. When the pressure is the tissue exceeds the pressure not in the tubing, the flow of the IV solution will be slowed down the stop. The corrective action is the remove that catheter and start a new IV line in another site. The condition and identified in the remaining option are likely to the accompanied by the warmth at the site of then coolness. The ninth question. The nurse is changing the central line dressing of the client receiving parenteral nutrition and notes that catheter insertion site appears reddened. The nurse should be the next assess which item. The correct answer is client's temperature. The explanation of this question: redness at the catheter insertion site is possible to indication of the infection. The nurse would be the next assessment for the another sign and infection of the options given. The temperature is the next item for the assess. The tightness of the tubing connection should be the assessed each time of the PN is checked. Loss of connections would be result to the leakage, not in the skin redness. The expiration date on the big available option, but this also should be the checked at the time of the solution is hang and with each shift in charge. The time of the last dressed change should be the checked with the each shift in charge. The 10th question: a client arrived at the emergency department following the burn injury that occurs in the basement at home, and the inhalation injury is suspected. What would be the nurse anticipated to the prescribed for the client? The correct answer is 100% oxygen via tight fitness and non-rebreather face mask. The explanation of question: if an inhalation injury is suspected to administration of the 100% oxygenation via a tight fitting non-breather face mask is prescribed until the carboxyhemoglobin level fall usually below 15. And inhalation injuries that oropharynx is inspected for the evidence of the erythema and blister and ulcerations. The need of the endotracheal incubation also is the assessed. Administration of the oxygen is aerosol mask and cannula are incorrect and would not provide the necessary oxygenation supply needed for the adequate tissue perfusion for the client with the likely inhalation injury. The 11th question: the nurse is watching for the cardiac monitor and client's rhythm suddenly changes. There is no P wave and inserted. There is no fibrillatory wave before each QRS complex. How should be the nurse interrupt into the client heart rhythm? The correct answer is arterial fibrillation. The explanation of this question: arterial fibrillation is characterized by the loss of P waves and fibrillation waves before each QRS complex. The atrium, the atria quiver, which is can be lead to the thrombus formulation. Okay, thank you for the watching. For more videos, subscribe my YouTube channel, and part 5 also is there. There is 50 question in this paper 3. Okay, thank you very much.